let everybody know who's behind this, why we created it, tell you a little bit about the story behind it, and why we're coming clean now. Who am I really? My name is Jeff Donnell, and I am president of No More Clipboard. And No More Clipboard is a personal health record company. We're headquartered in Indiana. And we actually spun out of a company called MIE, Medical Informatics Engineering. MIE started back in the mid-90s and actually built one of the first sustainable health information exchanges in the country. We've got almost 95% of the doctors and hospitals and medical professionals in Northeast Indiana sharing clinical messages, about 1.5 million of them per month in our neck of the woods. And with that HIE built, the founders of MIE then started to develop a full portfolio of web-based electronic health record products. And again, in our backyard, had very, very high penetration, where almost 65% of the doctors have some form of computerized health record. In about 2003, the founders of MIE formed No More Clipboard, and we decided to make it a separate legal entity, in large part because we had philosophical concerns with the concept of a tethered patient portal. So, you know, there are plenty of electronic health record vendors out there that have this tethered or almost shackled portal, and it does have its value, but generally the consumer, the patient, can't add information, they can't take the information with them elsewhere. And we really believe in a portable, interoperable model that enables patients to easily compile and manage and share their information wherever they're at. It's pretty simple. People told us horror stories about how, my buddy down the street who refers patients to me spent an arm and a leg on an inflexible system. He had to change his clinical workflow to fit the software. He had to see fewer patients for the first 6 months while he got used to the new system, et cetera, et cetera. And we found that people just, not only did they not want to talk about our products, they didn't want to talk about electronic health records at all. They had just heard too many tales of woe. How can we come up with a creative way to shine a light on the fact that there are some questionable practices out there in the vendor community? And we didn't want to name names. We wanted to take a bit of a high road approach, but have some fun with it. And we're not a huge organization, as you'll see on the show floor. I mean, we have a nice exhibit, but we don't have an aircraft carrier. So we needed to do something kind of innovative and subversive, and we consider ourselves to be sort of a challenger brand. So one of those late night bouts of inspiration, aided by a little bit of liquid inspiration as well, came up with this idea. Well, what if we created a fake EHR company that is the embodiment of everything wrong with the vendor community? And my first thought was, no, we couldn't do that. And I thought, well, what if we did? What would we name it? So I started writing down on a piece of paper, what are the common complaints, and actually pulled out a lot of research that's been done. And the two things I saw were, concerns about cost and the fact that you often have to change your workflow to fit the software instead of the other way around. So extortion and conformity. Extormity.